Adjustments that primarily engage the rotation lever are more desirable to use when adjusting segments where the primary restriction is in rotation. This is common in the mid to upper lumbar segments. Before you perform an adjustment, you need to test and figure out what it is that you will be adjusting. Perform a hip drop test, a standing flexion test, and a segmental Kemp's test. You can even use segmental motion tests that should have been a part of your training. Determine what the position of the facet is. This will guide you as to the barriers you need your adjustment to address. Once you have a position of the facets and the barriers you need to change, it's time to set up your adjustment. In this particular example of a rotation adjustment, the bottom L5 vertebrae of that segment is rotating towards the side that you've asked the patient to lay on, and the top L4 vertebrae of that segment is counter-rotating away from the side that you've asked the patient to lay on. This gives you the desired effect of the adjustment. So in this particular example, we'll ask the patient to lay on their left side. Remember, safety and accuracy are your primary concerns. This 5-step process will help you achieve the basics of safe and accurate lumbar spine manipulation. Step 1. Position the treatment bed just above your knees. It may be slightly different depending on your body makeup. Their top knee should be bent and their top foot should be tucked behind the lower knee. With your right hand, palpate the facet that you are planning to cavitate. Throughout this process, we will go to great lengths to make sure that we continually palpate the joint we are trying to affect. In this case, it's the upper right facet of the L4-5 segment. Now, place their bent knee between your thighs and place your left hand under their lower knee. This is where you find your flexion extension barrier through articulation of the facet joint in flexion and extension. In this case, we are finding the extension barrier. This is referred to as the lower lever. Step 2. Swap your palpatory fingers from your right hand to your left hand. With your now free right hand, grab the patient's lower elbow and ask them to grab yours. This is known as the upper lever. Using this upper lever, pull the arm towards you until you feel the tissues at the upper right L4-5 facet joint begin to wind up. This is the rotation component of your lockup. Now we have engaged the extension, side bending, and rotation barriers. It's time to line up your thrust. Step 3. Take the patient's hands and ask them to grab their forearms. The more flexible the patient, the higher up the arms they will need to hold. Now, take your right arm and place it through their arms, and if possible, take your fingers back to the facet joint for palpation. Take your left forearm and place it across their pelvis, covering the PSIS and the apex of the superior rim of the upper innominate. The line of direction of your applicator arm should be in line with the patient's top thigh. Step 4. Keeping the patient in that position, if possible, keep palpating the facet joint with your right hand. Now, roll the entirety of the patient towards you so that your left shoulder and chest is directly over the facet joint you want to affect. This allows you to drop your weight directly down on top of the facet joint when thrusting. When performing this step, patients will sometimes bend their bottom leg at the knee. Make sure the patient's bottom leg remains straight and give them the instructions not to bend the knee. This will maintain adequate tension through the posterior chain. Your left leg should go back, taking you into a split stance, with your knees comfortably bent so you can spring. You can apply some tension as needed on the upper lever to maintain tissue wind-up at the facet joint. When attempting a rotation adjustment, tension from the upper limb should be firm, so as to provide a stable counterbalance to your thrust, which is rotary in nature. In this position, you can begin to spring the joint so as to learn where the barriers are. Step 5. Once you feel where the barrier is that you need to push through, apply a sudden, sharp, and fast thrust directly downwards on top of your arm that has been placed on the innominate. Speed is your aim when applying a thrust. The direction of the lower lever arm and your lockup position should direct the force towards the facet joint in a rotary fashion. The thrust should be a much faster and firmer extension of the springing you were doing seconds earlier. This would normally create a cavitation pop sound, which is highly desirable but not always necessary. The main thing is that you apply a lockup to address the facet restriction, and then apply a force firmly and fast enough to move the joint past its pathological barrier. It's now time to retest to see if you have made changes to the facet joint based on the testing you performed prior to your adjustment. Retest the same motion tests that you performed before the adjustment to check if you're happy with the change in range of motion. The achievement of the desired change would indicate a successful adjustment. Now it's time to apply these steps in your clinic and refine your technique. This 5-step process will help you achieve the basics of safe and accurate lumbar spine manipulation.